Welcome to this presentation on muscular slings and sacroiliac joint. My name is Ismail Saracoglu. Objectives today: first of all, I'm gonna talk about a bit of background of muscle slings, then the anatomy and their functions, and then I will go on with the relationship between slings and sacroiliac joint. And finally, I will try to explain why these slings are important for SIJ. Okay, we know body functions as a whole, and Yanda described three chain reactions which are responsible for body functions. They can be classified articular, muscular, and neurologic chain. Of course, they work together. And remember that a chain is only as strong as its weakest link. But, as I said, today I will just focus on muscular chains. If we look a bit of background of muscle slings, we can see different approaches about muscle chains. The researchers described how chains of muscles influence the quality of the entire movement that are linked together. For example, European researchers such as Benninghoff, Tittel, and Brugger recognized the functional connections of muscles. However, Myers referred to these muscle chains as anatomy trains and based these patterns on fascial connections throughout the body. But the most widely hypothesis about slings is Yanda's approach. He recognized both fascial and functional factors in muscular chains. So, what does slings mean, or what is that? Muscular slings or chains are groups of muscles that work together or influence each other through movement patterns. Several major muscle slings have been identified, and they work together to produce functional movement rather than isolated muscle contraction. Therefore, we cannot think of muscle strain solely in terms of origin and insertion. They also provide movement and stabilization across multiple joints. And Willeming et al. Found that muscle slings facilitate rotation and transfer forces throughout the trunk, particularly from the lower body to the upper body. So, we can see in any books for SIJ that slings are also important for SIJ functions. But how or why? Let's remember SIJ joint knowledge that the SIJ need to be stable for the pelvis to function normally so that they can act as shock absorbers between the lower limbs and spine. And also in order to act as a proprioceptive feedback mechanism for coordinated movement and control between trunk and lower limbs. So the SIJ achieve this stability via form closure and force closure. The form closure is the shape, the structure, and the congruency of the sacroiliac bones. And associated sacral ligaments provide the passive stability. We can imagine two Lego pieces for form closure and how they fit together. The force closure forces external forces exerted by muscle system through their attachment into connective tissue, ligaments and fascia, to compress and stabilize the sacroiliac joint and hence the pelvic girdle. So adequate force closure is vital to allow for movement of the sacrum during activities such as walking, transferring, and bending. So form and force closure should be balanced. If a person lacks form closure, perhaps because genetics or anatomy, they will require more stability from muscles that assist in force closure. This is where muscular slings come into play. According to Willeming et al., the slings that provide force closure in the pelvic girdle, the muscular elements of force closure can be divided into the inner and outer muscular units. The inner unit is called as a primary sling, and the outer unit is comprised of four muscular slings, which are anterior oblique, posterior oblique, deep longitudinal, and lateral sling. According to Willeming, also if the muscular slings fail to secure the SIJ, this can lead to pelvic pain and dysfunction. So, let's go into details about these important slings and their functions. First sling is primary sling, or we can call inner unit. There are four important muscles which are multifidus, transversus abdominis, internal oblique, and pelvic floor. They provide local stabilization of pelvis. Another slings is anterior oblique slings, and as we see components of these slings, pectorals, external oblique, internal oblique, and contralateral adductors. And its action is securing the pubic symphysis when all muscles contract bilaterally. Also, we can see how these slings work together in the pictures. Next sling is posterior oblique, which consists of latissimus dorsi, thoracolumbar fascia, and gluteus maximus. Also, some others would add biceps femoris. These slings act on the sacrotuberous ligament, thus compressing the SIJ. Next one is deep posterior longitudinal slings, and components of these slings: lumbar erectors, thoracolumbar fascia, sacrotuberous ligament, and the long head of biceps femoris. Action of these slings is giving strong SIJ stability, and it also gives compression to L5 and S1 and also SIJ. The last one is lateral sling, which consists of gluteus medius, gluteus minimus, iliotibial band, and TFL. So action of these slings is stabilization with gait. So we can ask the same question: why these slings are important for us? It is thought that the failure of any of these muscular slings to secure pelvic stability can lead to lumbopelvic pains or dysfunction. This is especially apparent for expectant women and women following childbirth, in whom posterior pelvic pain and symphysis pubis dysfunction are very common. Also, athletes involved in high impact activities who have lumbopelvic pains from walking, lunging, and landing from jumps, they often suffer from dysfunction of these muscular slings as well. But in the literature, there is a big gap about slings and SIJ. Of course, there are some different studies which just focus the effects of muscle stabilization for SIJ. For example, Holm et al. Found that when SIJ is stimulated, the joint activates the gluteus maximus, quadratus lumborum, and multifidus. Also, according to Richardson, contraction of the transversus abdominis has been shown to increase SIJ stability. Also, Hungerford et al. Found that pre-activation of the multifidus and internal oblique muscles contributes to compression of SIJ. But finally, I want to talk about one more study which can be considered as a study about muscle slings. In his thesis, Yanda reported that the gluteal muscles are inhibited in patients with SIJ dysfunction and activate the contralateral latissimus dorsi during activate hip extension. So this study could be regarded as a study about posterior oblique slings. Because, remember, posterior oblique chains muscles consist of gluteus maximus and latissimus dorsi. Similarly, as I mentioned in the beginning of this presentation, Fleming et al. Found these two muscles are responsible for stability of body. But to sum up, we can't say there is enough studies about muscular sling. We can see these slings in any anatomy books, or many others mention the importance of slings for SIJ. However, there isn't enough evidence to support their hypothesis. And also, we usually see the same researchers such as Yanda, Fleming, and recently Diana Lee in the literature. That is another confusing thing. But in the meantime, I think we should consider about force closure during assessment and treatment of SIJ. In other words, we shouldn't forget that muscles might be as important as joint movement or mobilization. In addition, Diana Lee has further described a comprehensive and easy to implement exercise program for rehabilitation of the unstable pelvis, utilizing these principles in order to restore of force closure mechanism. Also, in addition with mobilization technique. But finally, I want to say again, we need further studies about muscle slings and the effectiveness of slings exercise on SIJ pain. So that's it. Thank you for your attention, and further information you can look at my reference. Hope you find this presentation interesting, and also your feedback is appreciated.